Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A large study published in the journal Circulation in October 2023 provided additional compelling evidence that the portfolio diet is an effective nutrition program to reduce risk of heart attack and stroke. So the portfolio diet emphasizes plant proteins such as legumes, peas and beans, tofu, soy milk, as well as nuts and seeds, and high fiber foods such as bran, oats, berries, and eggplant, as well as monounsaturated fats from foods such as olive oil and avocado. So the study followed almost 74,000 women in the Nurses' Health Study, another 92,000 plus women from the Nurses' Health Study 2, and almost 44,000 men from the Health Professionals Follow-Up Study, all of whom were free from cardiovascular disease at the point when they entered the study. So the study recorded dietary pattern updates on all individuals every 4 years and provided data on up to 30 years of total follow-up. So you have thousands of people being followed for up to 30 years. You start to learn something when you have this much data in your hands. So the results show that the nurses and the male health professionals who most closely adhere to the portfolio diet pattern of eating had a 14% lower risk of having a heart attack or a stroke than individuals who were least compliant. So the least compliant individuals consume diets that contain more high-fat animal foods such as beef and pork and high-fat dairy products, which are rich in saturated fat and cholesterol. As well, the nurses and the male health professionals following the portfolio diet showed lower blood levels of cholesterol and lipids than those who were least compliant with the principles of the portfolio diet. So the researchers commented, and I quote, "This study provides additional evidence to support the use of plant-based portfolio dietary pattern for reducing the risk of cardiovascular disease, which aligns with the American Heart Association guidelines promoting consumption of whole grains, fruits and vegetables, plant-based proteins, minimally processed foods, and healthy unsaturated plant oils such as extra virgin olive oil." So I think this is really important information. For many reasons, it's helpful to reduce the intake of beef and pork and high-fat dairy products and other processed foods that are high in saturated fat and trans fats. The guiding principles of the portfolio diet are a good way to acquire heart-healthy fats, phytonutrients, and fiber, and to avoid foods linked to heart disease and stroke. It's really that simple. But I would also recommend taking a supplement by the age of 45 that contains CoQ10 and hawthorn to help prevent the heart muscle from weakening, which leads or can lead to congestive heart failure, which is the leading cause of hospital admissions in those who are 65 and older. So that's the other part of the heart disease story, is that your body runs out of CoQ10 as you get older, so the heart pump gets weaker. So even if your arteries are not clogged, the heart muscle still can't contract with optimal force. Our bodies make less coenzyme Q10 as we get older, but supplementation with CoQ10 and hawthorn, which sort of work together, can help prevent the heart muscle from weakening, and they both play a key role in energy production within the heart muscle, so the heart pump can maintain optimal pumping power. CoQ10 and hawthorn supplementation can also help to prevent the age-related rise in blood pressure, which is also quite common. But I've included the reference for the portfolio diet study in the text below. I think it's valuable to look at this dietary pattern of eating, trying to get the fats and cholesterol that contribute to heart disease out of the diet. The portfolio diet is a great way to get the heart-healthy nutrients into the diet. So thanks for watching.